Good morning, everybody. Welcome to the Alberta Health Services Board meeting. My name is Linda Hughes, and I will be chairing the meeting. I'd like to start, if I could, with a review of the agenda. Does anybody have any additions or changes to suggest? No? Could I have a motion? Thank you, Glenda. Seconder Hugh, to approve the agenda. Any conflicts of interest? Anyone would like to declare a conflict of interest? No, hearing none. Approval of the minutes. You all have them in front of you. I think we saw them yesterday, did we? Would somebody like to move minutes? Glenda again? You? Okay. All in favor? Okay. Well, thank you very much. It's been a busy month for AHS. Some of that you'll see reflected in what we do at the board today and in some comments we'll have later from Dr. Verna Yu, who's the interim CEO. I wanted to talk just about a few things. The first thing I wanted to talk about is our People First strategy, which is one of the organization's 4 foundational strategies. And one of our senior leaders who's here today, Todd Gilchrist, will share some more information about that. We'll talk about that in committee. But I just wanted to really highlight the importance of this work. As you may know, AHS has over 120,000 employees. Somebody suggested if we put them all together in one spot, it would make us the 3rd largest city in Alberta. So that's a lot of talent and energy to harness. And as some of you will know, AHS actually has among the lowest administration and management costs of any healthcare region in the country. So we need an effective workforce strategy to lay the groundwork of how we deal with what we call our most valuable research. And it certainly is our most valuable resource. The People strategy has been in development for more than a year and involved consultations with more than 60,000 people who work in AHS or alongside us. Today we'll be discussing the document itself and how we plan to roll it out in June and to ensure that we have measures in place to actually monitor our progress on that strategy. We have to get this right, obviously, because for AHS to achieve its goals, our staff, physicians, and volunteers have to feel engaged in the organization. So with that in mind, the People strategy has 2 main goals, and that's to have a safe, healthy, valued workforce and to improve patient and family experiences, quality, and safety. And I think all these goals basically just go hand in hand because the research shows that when healthcare workers are highly engaged in their work, patient outcomes improve and patient satisfaction scores increase. So it is a workforce strategy, but really it's the goals will benefit everybody, both the people who work at AHS, the people we partner with, and as well as the people we serve. As a board, we do recognize that AHS needs to do a better job of engagement, both internally and externally. So the development and implementation of this People First strategy is just one part of the way we hope to improve engagement. Another part is the fact that we're establishing today a standing committee of the board as part of our refresh commitment to community engagement and public participation in healthcare. The Community Engagement Committee will oversee the organization's outreach to communities across the province. We want communities to recognize that AHS is a partner in their health and their well-being. We have lots of excellent examples of how AHS already engages with communities. A great example, I think, is 2 years ago, the South Health Campus in Calgary was named one of the top 12 hospitals in North America for providing patient and family-centered care. And really that came about because the hospital established a patient and family advisory council that informed all the decisions about the hospital, both before, during, and construction of the facility. So everything about the hospital that has been so successful, the bright rooms and hallways and the kind of family-friendly visitation policies, all those things that were designed to meet patients and family needs were all the advice we got from our council. So that was a case where consultation with the public worked so well for AHS and I think for the community it serves. On the provincial level, we have 12 health advisory councils and 2 provincial advisory councils, and they give Albertans an opportunity to share their thoughts and their opinions and their concerns about healthcare delivery in their communities. Those councils, for instance, have been instrumental in recruiting physicians to some of our rural communities and helping address some of the complex issues we face, for example, in continuing care and emergency medical services. Our other community engagement initiative is our Wisdom Council, which provides guidance and recommendations on service delivery and program design to ensure accessible, effective, and culturally sensitive care for our Aboriginal peoples in Alberta. There's lots of examples, actually, of AHS doing broad consultations, including the work that we did prior to announcing our Patient First strategy. The new board community engagement committee is just beginning to plot the roadmap for its work, but will start by getting regular updates from AHS staff on the community engagement activities throughout the organization, and will guide us as we use community input on decision making. The committee in turn will report to the board on their activities. On a related note today, we'll discuss changes to the bylaws that govern our 12 health advisory councils. These changes will help us launch a new recruitment phase for the councils. It's crucial, I think, that everyone on our councils have full membership and that members reflect the diversity of voices around the province. Finally, some other things that the board has been working on recently. As everyone knows, AHS is in the process of recruiting for a president and CEO. I'm happy to report we've had a lot of interest, many applicants, and we're currently working through lists of high potential candidates. We said at the beginning we thought this process would take 4 to 6 months, and I think we're on track for that. AHS is also continuing to prepare for June 6th, which is when physician-assisted death essentially becomes legal under certain circumstances in Canada. AHS has worked with our partners and stakeholders for more than a year to be fully prepared to support patients and families in the wake of this Supreme Court decision. We've posted online resources and information for patients and families, as well as for health professionals, about the pending changes. This is an emotional, obviously, and very personal issue to Albertans, but I am confident AHS is ready now and again on June 6th to help Albertans know and understand all the healthcare options available to them in the areas of palliative care and end-of-life care. Finally, in the next few weeks, we'll also be finalizing our budget and healthcare plan and business plan, which will guide our activities and set our goals for the future. As the board moves to a new committee structure, I want to take this opportunity in particular to thank 3 Albertans who've been an enormous help to the health service in the last few years. During the time when AHS had no governing board, these 3 individuals chaired committees that helped the official administrator oversee the organization. And when the board was appointed at the end of last year, they agreed to stay on until the end of this month when board members would take over chairing those committees. So a special thanks to Don Sieben, who chaired our Finance and Audit Committee for many, many years, to Barbara Burton for chairing our Human Resources Committee, and to Doug Tupper, who chaired the Quality and Safety Committee. You've all provided great leadership and support for AHS, and we thank you for all that hard work over many years. And of course, I'd like to thank again Dr. Berna Yu for the great job she's been doing as interim CEO since the start of the year. And with that, I would hand it over to her to update us some more. Thank you.
Great. Thanks very much, Linda. And good morning to everyone. I'm very pleased to be here and provide an update about what's been happening within Alberta Health Services over the past few weeks. We've made some significant progress, especially in terms of our foundational work. One of the first things that I wanted to do when I started this interim role is to put in some key pieces that will provide clear direction and purpose for everybody in the organization. So last month, AHS physicians, staff, and volunteers were given an opportunity to vote for and comment on a new vision for the organization. And I want to really thank everyone for their participation. This led to 13,000 votes, more than 12,000 comments that led to our new vision, which is healthy Albertans, healthy communities together. Our staff, physicians, and volunteers told us that they wanted the new vision to reflect inclusivity, community, and our shared responsibility for health and wellness. And I hope that this simple but powerful statement resonates with Albertans, because this really belongs to all of us. It speaks to our shared desire and our shared responsibility for improving health, wellness, and quality of life in the province. Our new vision will inspire and unite our work to fully advance our patient and family-centered care throughout our system. The second part of laying down our foundational work is to ensure that we have values to aspire to, because values are really at the heart of what we stand for. AHS has had 7 values for most of our existence: respect, accountability, transparency, engagement, safety, learning, and performance. It was a different time and a different place. And although these values have served us well, with a new vision in our place, now is an opportune time to look at our values and ask ourselves, are these really the right values for the organization? How do we embed them, and how do we live them? Like our vision work, we will refresh our values in a way that hears from many diverse voices. So we have embarked on a broad consultation, and over the next 2 months, we'll be seeking input from a cross-section of employees, physicians, volunteers, and patients and families through both face-to-face and online discussions. Vision and values are important to an organization. They enable the 100,000 plus people in our workforce to head in the same direction, to embrace the same ideals, and to pursue the same goals for the benefit of patients, clients, and families. And I must point out that while this vision and values work is happening, at the same time we are continually working on improving our healthcare through patient-centered innovative care initiatives. So let me share with you one example. We've been working with long-term care facilities in the province, as well as with families of loved ones in those facilities, to reduce the use of antipsychotic medications. These medications are sometimes used to address behaviors in people with dementia, including aggression, thereby becoming a threat to themselves and others. But we know that these medications can have serious side effects and medical complications, including increased risks of falls, strokes, confusion, loss of independence, and oversedation. So 3 years ago, the Seniors Health and Addiction and Mental Health Strategic Clinical Networks, partnering with Alberta Health, worked with long-term care facilities and families to find ways to address difficult behaviors without the use of medications. Care teams started using alternative strategies, including exercise, music, and art, to calm and comfort individuals as their antipsychotic medications were being withdrawn. By January of 2014, there was a 50% reduction in usage of antipsychotic medications in residents with dementia in 11 pilot long-term care sites. And that success has led AHS to roll out the project to all 170 long-term care sites in the province, including those owned and operated by AHS, as well as of contracted providers. But those numbers, impressive as they are, don't tell the whole story. Many families reported their loved ones are becoming more aware of their surroundings and are more capable of engaging in conversations once they were weaned from these medications. I have a short video that we will share with you to provide some details on this project.
So the Appropriate Use of Antipsychotic project is a collaborative between the Seniors Health Strategic Clinical Network and the Addiction and Mental Health Strategic Clinical Network. We brought together long-term care teams from all across the province to learn about why antipsychotic medications carry some hazards and how they could help reduce the use of the antipsychotics in their sites.
Within long-term care environments, about 75% of people have some form of dementia, perhaps a little lower than that in supportive living facilities, but essentially these are individuals who have not just memory impairment, but severe impairment in thinking and behavior sometimes. When new behaviors emerge, very often the response had been to simply request a medication to manage that behavior. Individuals with these behaviors may be responding to something in their environment, something personally, whether it's pain or distress. And so rather than going straight to treatment with antipsychotics, part of our learning for the teams has been to identify, to think about what may be causing this, and then to use non-pharmacological approaches first.
He couldn't leave his wheelchair because he couldn't stand. He had tremors really bad. He was aggressive, very agitated. We have made some progress with diminishing a lot of those drugs, and now, as you can see, he's using his walker. He is talking to me, and he's happy. He relates to us. And he smiles just like he did before.
A son said that Dad's able to talk about his collection of collected cars that he has in his room. And he said, I never thought I'd hear any of those conversations again.
And as you can see from the video, this project is providing Albertans with that most precious gift, which is quality time with your loved ones. Today, we have reduced the usage of these medicines from over 40% to less than 20%. And we are leading the country where the national average of usage is about 27.5%. We are leaders in this area because we are working together with our long-term care and community partners along with Albertans. Together. Just as our new vision statement says, the appropriate use of antipsychotic project is just one of many initiatives happening across AHS that's improving the quality and safety of care for our patients. This is one of the many reasons why I'm very proud to be part of this incredible organization and optimistic that we can and will overcome the challenges that are facing Alberta's health system and health systems across the country. I would like to thank Linda and the board for their continued support and commitment to providing AHS with good governance. I would like to thank the staff, physicians, and volunteers of AHS for their efforts in making a difference to Albertans each and every day. And I'd like to thank the members of the public for being here today and for your interest. Thank you.
Thank you very much. Does anyone have any questions for Verna about that? No? Okay. Thanks, Verna. That was very interesting. So now we would move to the Human Resources Committee, and Marlis, you're giving the report of the Human Resources Committee.
Thank you, Madam Chair. I'm delighted to be giving this on behalf of Mr. Richard Dicerni, who couldn't be here today, who's the chair of this committee. We had two meetings since last time that we have met, February 4th and March 17th. The way that it is set up is that all members of the board are part of the committee, and there were at that time 4 external members. The president and CEO are ex officio members, and the vice president of human resources is a standing management attendee. So what we have worked through in terms of workforce overview, we were given an overview of the workforce size and the composition. We talked about the Peaple strategy as being one of the foundational strategies of AHS. The board provided some feedback to management on the draft, and then we have seen the redraft since that time, and we'll be talking about it more shortly. Under labor relations update, the committee received an update on the collective bargaining matters relating to AUPE, General Support Services, and the AUPE, Auxiliary Nursing. Item 4, we looked at management and out-of-scope total compensation overview and had a conversation related to that regarding non-unionized and excluded employees. Workforce indicators and performance targets was one of our topics. The committee was presented with an overview of the workplace indicators, and what we found is there is a dashboard that gives an ongoing or point-in-time snapshot of the 20 metrics that are being tracked. The dashboard is published quarterly and posted to AHS's internal website. In addition, managers can access that and then use that information to better reach the targets that are there. The committee was advised that in general, the third quarter workplace indicator indicates that we've improved over 2015 and 16 compared to 2014-15 actuals. And there were notable improvements in respect to overtime hours, a steady workforce size, and the reduction in disabling injury rate. Identifiable areas that will be monitored include labor cost expenses, voluntary terminations by non-casual employees, and sickness rates. The committee was advised that the workforce indicators will be refreshed in 2016 and 17 to align with and support the strategy and its long-term high-performance targets and success measures. Item 10, we looked at size comparability of senior leadership and management and had a discussion regarding that, as Linda kind of referred to in her comments. For management and out-of-scope compensation program, there was a verbal update, and the committee was provided with a brief update on the status of draft policy to address compensation and inversion matters. The committee was advised that the policy would be brought back for information and discussion. Under labor relations, the committee provided background on the essential services legislation that was just introduced by the government. It's anticipated that the legislation will be effective in June of 2016. The committee was advised that the legislation will require essential service plans to be entered into by parties to collective agreements within 120 days of the effective date of the legislation, unless the parties agree to some sort of an extension. AHS has already commenced the work on this in this regard. The committee was provided with an update on the status of collective bargaining with respect to AUPE, General Support Services, and Auxiliary Nursing, and the Professional Association of Residents of Alberta. And the committee was advised that there have been some introductory meetings between the board chair, the interim CEO, and reps from UNA, HSAA, and AUPE. We received an update on the negotiations between Alberta Health, the Alberta Medical Association, and Alberta Health Services. There was the engagement survey, and engagement in the engagement survey stated close to the same at 53%, or it was 53%, and this time went down to 51%. One of the learnings from this was that different groups have different items that will engage them. So the employees have things like organizational vision, innovation, professional growth as a driver for their engagement. Medical staff are concerned with information communication and quality and safety and teamwork, and our wonderful volunteers look at volunteer resources leadership, volunteering and life balance, and information and communication. Management advised that because different groups had different drivers, then there will be some tailored work done towards each of those groups to encourage them to become more engaged over time. There is also human resources support, online resources, and a series of webcasts that are available to leaders to support their local action planning. Mandatory cultural competency training, we had a report from developed by the Alberta Health Services Aboriginal Health Program, including the Aboriginal People in Alberta introductory course and the Aboriginal Awareness and Sensitivity e-learning modules. The leadership team of the executive endorsed the introductory course being included as being mandatory for new employees. This happened in November 2015, and new physicians and all AHS management and physician leaders are to complete the introductory course by April 1st, 2017. And the committee discussed opportunities to make the introductory course or the e-learning modules mandatory to a broader group within AHS. Our last item, we looked at workplace health and safety, the quarterly update. The committee received an update on workplace health and safety for the third quarter. The committee was advised that steady progress is being made to a safe, healthy, and inclusive place of work. The committee was advised that the workplace health and safety in the healthcare sector is generally really low because there are just so many challenges to working in health. But Alberta Health Services is one of the best amongst healthcare providers. Management spoke to the reduction of days lost due to injury and noted the positive effects of initiatives such as on-time reporting, tighter processes with case management, and working with operations to embrace modified work arrangements. The committee was directed to the discussion in the report about the psychological safety and mental health strategy and the work to date on the prevention of violence in the workplace. We do have another committee meeting scheduled on May 12th of 2016. At this point, though, I would like to invite Mr. Todd Gilchrist, Vice President of Human Resources, to speak to us a bit more about the Peaple strategy.
Thank you, Marlis, and good morning, everybody. It's my pleasure to be here today to be able to speak to you a little bit further about what has already been mentioned by Linda and Marlis, the culmination of over a year's worth of work on the organization's new Peaple strategy. As Linda and Verna both noted, our goal in the organization is to improve patient and family experiences, quality and safety by helping our people feel safe, respected, and empowered. Our workforce, employees, physicians, and volunteers have told us that they need this, and our Peaple strategy outlines how we will go about doing it. Our people have told us the most important thing that we can do is to improve health care for Albertans. They've advised us that working with knowledgeable teams keeps them motivated, energized, and engaged. That they, like everyone else, want to be treated with respect and equality. Our people strategy will guide our actions on how we can support our people, including, but not limited to, seeking frontline managers' advice on issues and initiatives impacting their teams and the communities in which they live and work. Strengthening the support leaders need to communicate and engage more effectively, and continuing to increase workplace health and safety. Ultimately, it's about being stronger together. And with that, I'd like to share a video with you that highlights our people strategy and what it's all about.
The Alberta Health Services workforce is a diverse group.
We are more than 108,000 employees.
And 9,300 physicians.
And 50,000 volunteers.
Working at over 650 sites across the province.
We come from many diverse backgrounds, genders, and identities.
We are health professionals.
And we are the people who support health professionals.
We are young.
We are young at heart.
And we are determined to help others and won't let anything get in our way.
Like the millions of Albertans we serve, it's a mix of ethnicity, culture, and customs.
We come from all around the world.
And we've always lived on this land.
Despite our diversity, we have much in common.
For starters, patients, clients, and families are at the center of everything that we do, every time.
We also need the same things in order to work to the best of our abilities.
We found this out after tens of thousands of Alberta Health Services physicians, employees, and volunteers like me.
And me.
And me.
Spoke candidly about our work, our environment, and our leadership.
This province-wide consultation was done to inform and guide our people strategy.
The strategy outlines 2 goals and 4 priorities for the organization.
That will enable each and every one of us to excel at our work.
And collaborate effectively with each other.
Because we know we are stronger together.
We need a clear vision for AHS.
The shared focus and common goals.
I need to see the bigger picture.
To feel connected to our organization's purpose.
And to know how I can contribute.
We need a safe, healthy, inclusive work environment.
And by safe, I mean emotionally too.
I want to work in an environment that works to protect my mental well-being.
And values me as a whole person who has friends, family, interests, and demands when I end my shift.
We said we need excellent leadership at every level of the organization.
I want to see leaders live our values every day.
And inspire my colleagues and I to do the same.
Good leadership makes me feel respected, valued, and supported.
Good leadership empowers others.
But I need some resources so I can help my team to be the best that they can be for our patients, clients, and of course their families.
We said we need to be empowered.
I'm not looking to rule the world.
I just want input into the decisions that affect me.
We want to be heard.
I want the ability to act on what needs to be done.
A reasonable workload.
A well-defined role with clear expectations.
And development opportunities so I can grow as a professional and as a person.
These are the things we need.
And your voices are here in our people strategy.
This is more than a list of what needs to be done.
There are action items attached to all 4 of the strategy's priorities.
And mechanisms to measure our progress. We will do this and do this right.
I would encourage you to learn more about our people strategy.
As well as our patient-first strategy, our values, and our just culture principles.
We're doing this to ensure that our people are safe, healthy, and valued.
And to improve patient and family experiences, quality, and safety.
These are achievable goals.
So let's do our part.
To make sure we're doing what we need to do to build a better, more responsive healthcare system.
I'm proud of the work I do to support frontline care providers.
I take pride in providing the best care possible for my patients and their families.
And we're proud of the work we do in our unit.
And when you take a look at the big,
and when you take a look at the big
picture, we know.
We have the power to transform the healthcare system for the better.
Because we are stronger together.
Stronger together.
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 Thank you, Madam Chair. I'm happy to answer any questions about the Peaple strategy. Thank you.
Thank you, Todd. And I want to thank you for all the work that you've done on this, you and your team, and all the employees and volunteers and medical staff that engaged in doing this. To the board, I would very much like to put forward a motion. I move that Alberta Health Services Board approve the proposed document entitled Our Peaple Strategy. Thank you.
All right. Thank you, Madam Chair. Since the last public board meeting, the Governance Committee of the Board has met twice, on February 24th of 2016 and on March 16th. At this time, all board members are members of the committee, and our President and CEO is an ex officio member. I propose to give a brief report on what happened at the two meetings, followed by bringing forward 4 motions, hopefully for approval by the board. On February 24th, we reviewed the mandate and roles document. The draft mandate and roles document was looked at, and we provided feedback to the corporate secretary, and the draft mandate and roles document has been sent to Alberta Health for their comments. The Governance Committee asked about the role and responsibilities of the Health Quality Council of Alberta, and our interim CEO, Dr. Verna Yu, spoke to a Health Quality Council of Alberta review of total parenteral nutrition and agreed to provide a copy to the committee members. Dr. Yu also agreed to provide a briefing note that describes the roles and responsibilities of the Health Quality Council of Alberta, along with a description of the AHS's interaction with the Health Quality Council. Those materials will be provided at April's proposed meeting of the Governance Committee. The committee discussed arranging a meet and greet between the Alberta Health Services Board and the Health Quality Council of Alberta Board. The committee also considered the committee structure for the committee's the terms of reference and proposed memberships of the various committees of the board. Ms. Linda Hughes, our board chair, noted the revised calendar that was proposed memberships for the board committees. She also discussed the process of each of the committees reviewing its own terms of reference and then having them approved by the board through the Governance Committee. We received an update on the CEO search. Executives from Boyden Global Executives Search attended the meeting, and along with Mr. Todd Gilchrist, Vice President of Human Resources, provided the committee with an update on the search for a new CEO. The committee discussed potential candidates and the selection criteria. We discussed the health advisory councils and the membership terms and member recruitment issues. There will be a motion brought forward on this in a few minutes. The committee was presented with an update on the roles and memberships of the health advisory councils. The committee, 1, supported the commencement of recruitment of new health advisory council members and recommended that the board approve the following amendments to the health advisory council bylaw. And we will be proposing that section 7.4 of the bylaw regarding terms of office be amended to include, quotes, "For clarity, each council member must reapply for their second and any subsequent terms as determined by the board," close quotes. We also will recommend that Section 7.5A of the bylaw regarding council chairs be amended to replace the word annually with the word biannually. This will ensure consistency by retaining the chairs in their position for 2 years. We discussed the tri-party health capital memorandum of understanding. This will be brought forward as a second motion in a few minutes. The committee was presented for review a draft of the memorandum of understanding for capital health projects between Alberta Health Services, Alberta Health, and Alberta Infrastructure. The purpose of the memorandum of understanding is to provide for the funding, designing, and construction of major capital projects. The committee recommended that the board approve the memorandum of understanding and authorize the board chair to sign the memorandum on behalf of AHS. On March 16th, we discussed the Health Advisory Councils and Community Engagement Committee. The Governance Committee recommended that the board establish the Community Engagement Committee of the board, and the committee reviewed a draft term of reference for the Community Engagement Committee. The draft term of reference will be presented to the newly established committee for review once it is established, and that will be brought forward as motion 3. We discussed a plan for renewal and application process for the Health Advisory Council members. The committee was advised that the renewal application process proposed for the Health Advisory Council members reapplying new terms when their 6-year terms have expired. The extension application process is similar to the normal recruitment process and will include an application and interview with a panel consisting of zone leadership, the community engagement leadership team, the Health Advisory Council officer, the council chair, plus an additional member of the council to be nominated by the chair. And the committee supported the proposed renewal application process. The Governance Committee looked at the issue of membership for the committees of the board. The committee reviewed the proposed membership for board committees and recommended the board approve the voting membership as proposed and supported by the board chair, inviting Dr. Tom Feasby and Mr. Gordwinkle to continue as external members of the Quality and Safety Committee. I should perhaps add that there will be a motion brought forward proposing voting membership of the individual committees. This affects quorum issues. We have, in matters of terms of reference, proposed that all board members remain non-voting members of all committees that they haven't been placed, specifically named as voting members for. In terms of reference for board and the chair and board members, the committee reviewed and provided feedback on draft terms of reference for the board, the chair of the board, and the board members. The revised draft terms of reference will be provided at a future meeting of the committee and will then be recommended to this board for approval. We had a verbal update on the CEO search. Mr. Todd Gilchrist, our Vice President of Human Resources, provided the committee with a brief update on the CEO search. The Governance Committee was provided with an overview then of the process involving the professional responsibility committees. These are committees that are brought out of the collective bargaining agreement with United Nurses of Alberta, and there is a process where their concerns can escalate to the board level, and the considerations with respect to the Professional Responsibility Committee and Occupational Health and Safety can be brought directly to the board. The Governance Committee heard about the tracking of the Professional Responsibility Committee and Occupational Health and Safety issues that are escalating to the point of going to the AHS Chief Executive Officer and further to the board. The tracking of those issues at the local level is the responsibility of the local Professional Responsibility Committee and Occupational Health and Safety Committees. The Governance Committee heard that if an issue remains unresolved, the local has the right to present its recommendations to the board. The board is then required to write the local within 14 calendar days of the presentation to the board. And the committee heard about the current outstanding Professional Responsibility Committee concerns that have escalated to the board and the recent resolution of one of those registered concerns. And our future meeting is presently scheduled to be heard on April 13th of 2016. As indicated, I will now propose some motions. Alberta Health Services would like to move forward with the recruitment of the new Health Advisory Council members and propose some amendments to the amended bylaw for Alberta Health Services establishing health advisory councils that relate to changing official administrator references to the board and providing for a 2-year term for council chairs to provide stability. And as per section 13.1 of the bylaw, any amendments must be approved by the AHS board and receive written approval from the minister. Therefore, Madam Chair, I move that the Alberta Health Services Board, A, approve the amendments to the amended bylaw for Alberta Health Services establishing health advisory councils as reviewed by the board, and B, authorize the board chair to sign the amended bylaw on behalf of AHS and direct management to submit the amended bylaw to the minister for approval and make the amended bylaw available on the public AHS website once ministerial approval is obtained. And I so move. Thank you. A second motion regarding the tri-party Capital Health Memorandum of Understanding. Alberta Health Services, Alberta Health, and Alberta Infrastructure Health Facilities Senior Executive Committee have endorsed a Memorandum of Understanding for health capital projects and recommend approval by the board and sign off by the AHS board chair, the Honourable Sarah Hoffman, Minister of Health, and the Honourable Brian Mason, Minister of Infrastructure. And therefore, I move that the Alberta Health Services Board approve the tri-party health capital Memorandum of Understanding between Alberta Health Services, Alberta Health, and Alberta Infrastructure, and authorize the board chair to sign the Memorandum of Understanding on behalf of Alberta Health Services. Thank you, Madam Chair. And as discussed earlier, the Governance Committee of the Alberta Health Services Board has recommended to the board to establish a Community Engagement Committee as an advisory committee of the board. Therefore, I move that the Alberta Health Services Board approve the establishment of the Community Engagement Committee. And the final motion I have to bring, Madam Chair, regarding membership of the committees. The board appoints members to its advisory committees in accordance with the AHS amended general bylaws. At its organizational meeting in December of 2015, the board had appointed certain members to its committees on a temporary basis with the intention that the board's governance committee would consider the committee structure and the membership and make recommendations to the board in that regard. The governance committee has considered committee membership and recommends the board approve the following membership of the committees effective April 1st of 2016. Therefore, I move that the Alberta Health Services Board approve the following voting members of the board's committees effective April 1st of 2016. The Audit and Risk Committee, David Carpenter, Chair, Glenda Yates, Vice Chair, Hugh Somerville, Member, Linda Hughes, Board Chair, ex officio member. The Finance Minister, the Finance Committee, David Carpenter, Chair, Richard Discerny, Vice Chair, Glenda Yates, Member, and Linda Hughes, Board Chair, as ex officio member. The Community Engagement Committee, Dr. Brenda Hemmelgarn, Chair, Marlis Taylor, Vice Chair, David Carpenter, Member, Linda Hughes, Board Chair and ex officio member. The Governance Committee, Hugh Somerville, Chair, Marlis Taylor, Vice Chair, Linda Hughes, Board Chair and ex officio member. Human Resources Committee, Richard Discerny, Chair, Marlis Taylor, Vice Chair, Linda Hughes, Board Chair and ex officio member. And Quality and Safety Committee, Glenda Yates, Chair, Dr. Brenda Hemmelgarn, Vice Chair, Linda Hughes, Board Chair and ex officio member, and Dr. Tom Feasby, external member, and Gord Winkle, external member. I so move.
I'll second.
Thank you, Madam Chair. That's the report of the Governance Committee.
Thanks, Madam Chair. This morning I have a report from the Finance Committee, and I will be presenting 3 motions for board consideration subsequent to the report. So since the last public board meeting, the Finance Committee of the Board of Alberta Health Services met twice, February 24th and March 16th. Committee members include all board members and 2 external members. President and CEO is an ex officio non-voting member. Standing committee attendees include the Vice President of Corporate Services and Chief Financial Officer, the Chief Program Officer, Financial Services, Senior Director, Financial Reporting and Treasury, and the Chief Audit Executive, Internal Audit and Enterprise Risk Management. The committee was presented for feedback a preliminary draft of the 2016 to 2017 health plan. The committee was provided background on the development of the health plan and an update on discussions with Alberta Health regarding AHS reporting obligations and performance agreement. The committee was advised that it would ultimately be asked to recommend to the board the approval of the draft health plan, which would then be submitted to the Minister of Health for approval. The committee discussed the high-level nature of the health plan. Management described that it would be presenting a detailed action plan based on the health plan for approval by the board within approximately 8 weeks after the health plan is approved. The committee also received information on the finalizing and approving of the 2016-2017 budget. Representatives from Phillips, Hager and North presented a summary of Alberta Health Services investment portfolio. The committee recommended that the board ratify the third quarter investment portfolio and transactions described to the committee. Now, AHS has entered into certain master services agreements with service providers with respect to continuing care. The committee was presented with proposed amendments to the master services agreements with Chantel Management, the Father Albert Lacombe Home, Rosedale Partnership, and the Brenda Stafford Foundation. The committee recommended that the board approve such amendments and delegated signing authority to the CEO. Management discussed the commitment to Management discussed the commitment to quality under these contracts, and the committee discussed the ability to conduct unannounced audits. The committee was also presented with an annual review of the Enterprise Risk Management Service Providers Risk Report. The committee received an update on the Laboratory Services Review, and the committee received for review the third quarter performance agreement, action update, and the third quarter performance measures update. The committee supported the submission of the updates by the board chair to the minister. The committee was presented for feedback a template of the AHS action plan. The action plan is a supplement to the health plan and outlines in further detail the specific initiatives AHS will focus on with respect to the health plan. The committee received draft 2016-2017 operating and capital budgets for discussion. The committee was advised that final versions of the budgets will be presented for approval in April. The committee was asked to recommend for board approval on authorization to spend, as the budget will not be approved by April 1st, 2016. The committee discussed AHS relationship with Covenant Health at the private board meeting on March 29th and were scheduled to meet again on April the 14th, 2016. So with respect to the investment report, as mandated by AHS investment bylaw, the Finance Committee is required to review reports prepared by management and investment managers summarizing the activities and performance of AHS investment portfolio on a quarterly basis. Regional Health Authorities regulation and the AHS investment bylaw describe the requirements for the board to approve or ratify by resolution AHS investment decisions. Finance Committee of the Board was presented the December 31, 2015 third quarter investment report and recommended that the Board ratify the following transactions. So therefore, here's the first motion. I move that the Alberta Health Services Board ratify the investment portfolio and transactions described below and is certified by signed investment compliance certificates from AHS and Phillips Hager North Investment Management. A, as at December 31, 2015, AHS held restricted and unrestricted funds managed by PH&N and Standard Life Canada totaling $1.553 billion. The funds are invested in short-term treasury bills, federal, provincial, and corporate fixed income bonds, pooled mortgage funds, bond funds, Canadian and global equity funds. And C, all of the funds invested during the quarter ended December 31, 2015 were invested in accordance with the investment bylaw and investments policy. I so move. Second resolution is on continuing care and amendments to the master services agreements. So the Finance Committee reviewed amendments to the following 4 continuing care master services agreements. The Alberta Health Services Board approval is required as changes to the agreements and or consolidation of smaller individual contracts under a single master services agreement bring the total contract combined commitment value greater than $30 million annually and or $90 million multi-year. Finance Committee recommended that the Board approve the amendments and delegate signing authority for the contracted services with respect to the 4 master services agreements to the Alberta Health Services President and CEO. Therefore, I move that Alberta Health Services Board approve the amendments to the following master services agreements as reviewed by the Board. 1, Chantel Management with respect to change in capacity designation and term. 2, Father Albert, just a second here. 2, the Father Albert Lacombe Home with respect to change in capacity designation and term. 3, Rosedale Partnership with respect to change in service delivery model. And 4, the Brenda Stafford Foundation with respect to change in term. And delegate signing authority with respect to the 4 master services agreements to the Alberta Health Services President and Chief Executive Officer. I so move. And thirdly, the authorization to spend. Finance Committee has reviewed a request from management for an authorization to spend, given that AHS 2016-2017 budget will not be approved prior to April 1, 2016. Finance Committee recommends that the Board approve the authorizations to spend. Therefore, I move that Alberta Health Services Board approve an authorization to spend for the period April 1, 2016 to June 30, 2016 of a maximum of $3.7 billion for the period April 1, 2016 to June 30, 2016. And secondly, maximum capital expenditures of $100 million for the period April 1, 2016 to June 30, 2016. So moved.
Seconder? You may ask a question.
Do we know when approval is expected for this spending?
No, I believe I'll let Ms. Rhodes answer.
We would anticipate budget approval after the passing of the provincial budget, which would be prior to the end of June.
This authorization to spend, we have to do this virtually every year, do we?
Yes, we do. Yeah, it's a standing it's a standing item, and then it will be superseded by budget approval.
Right. Okay. Thank you. All right. All those in favor? Carried. Thank you. Now, David, do you do the audit committee as well?
Yes, Madam Chair. I have a report from the Audit Committee and no resolutions for your consideration. So since the last public board meeting, the Audit and Risk Committee of the Board of Alberta Health Services met once on February 24th. Committee members include all board members and 2 external members. President and CEO is an ex officio non-voting member. Standing management attendees include the Chief Audit Executive, Internal Audit and Enterprise Risk Management, Vice President and Corporate Services and CFO, Chief Program Officer, Financial Services, Senior Director, Financial Reporting and Treasury, and the Director, Internal Audit. Individuals from the Office of the Auditor General also attend the meetings of the committee in their capacity as external auditors of AHS, and individuals from KPMG attend parts of the meetings in their role as agents of the Office of the Auditor General to carry out the audit of AHS. So the committee received the third quarter financial report and forwarded it to Alberta Health. The committee was presented with information on the status of outstanding recommendations of internal audit and the Office of the Auditor General. The committee was advised that there were 67 outstanding recommendations, 38 from internal audit, 29 from OAG, and that of the 67, 52 are in progress and 15 management reported as implemented and ready for follow-up. The total number of outstanding recommendations has decreased 23% from the last reporting period on June 30th, 2015, as a result of auditors confirming the implementation of 26 recommendations. Management highlighted the solid progress that had been made to address recommendations and noted complexity as typically the reason for delay in implementing certain recommendations. There are a number of recommendations currently in progress that are experiencing delays in implementation. However, the majority of the 26 delayed recommendations should be fully implemented within the next 12 months. The committee was presented the December 31, 2015 Enterprise Risk Management Risk Report. This review is conducted with risk owners and risk leads to provide an update and validation of the AHS Enterprise Risk Register status. The AHS Enterprise Risk Register's main purpose is to ensure an appropriate review of key risks and is designed to include the key risks that may impact the organization's ability to achieve its strategic objectives. The committee received the IT, so Investment Technology Disruptions Risk Reports as at December 31, 2015 for annual review and feedback. Next meeting is scheduled for April 14th, and that is my report, Madam Chair.
Okay. Thank you very much, David. All right, our final committee report is Quality and Safety. Glenda?
Thank you very much, Madam Chair. I have a report from the committee's last meeting and then 2 motions to present to the board for consideration. Since the last board meeting, the Quality and Safety Committee of the board has met once on March 3rd, 2016, and like the other committees, it includes all board members. There were 5 external members who were part of that committee at that time, and obviously appropriate AHS senior staff. I'll mention we considered a number of things that I'll report on and then put the 2 for approval at the end. We had, as I mentioned in our last report, a patient safety moment. So at the beginning of each of our quality and safety meetings, there is what I think is very good practice of reporting on one of the examples where there's been a strong a notable example of building a culture of safety and openness and improvement in the organization. One that was presented at our last meeting, the topic was about hospital-acquired infections and disclosure to patients. And it was very evident to the committee the commitment of the staff and the very good work that had taken place, and actually the very significant improvement in results that initiative had resulted in. The committee noted that there had been In terms of our performance measures, hospital-acquired infections were decreasing, obviously a very positive thing, and hand hygiene performance was increasing. And we discussed the question about how to support, in addition to being very supportive of this particular example, how we had a discussion about how to spread these kind of best practices throughout the organization to continue the improvement in quality and performance that we had seen. The second item that was considered was an update on the state of readiness for physician-assisted death, and as was noted, Madam Chair, in your opening remarks, that there's been a great deal of work that has taken place in Alberta Health Services, significant involvement by relevant and key parties within the organization and outside it. And I think the committee was very pleased with the work that had taken place. It was clear that we were continuing to monitor the legislative developments, federally in particular, so that we would be very much in a position both now and then after the passage of the federal legislation that is pending to provide this support to Albertans. And the materials, as were noted, are already posted on the Alberta Health Services website. The third item that was dealt with was a presentation on the strategic clinical networks, and these are, we had a briefing on the 9 strategic clinical networks, or as they are called, to shorten that, SCNs. These are networks that were launched within AHS in 2012 to develop and spread clinical innovation and improve quality and to contribute to the efficiency of care delivery throughout AHS. We had a briefing on the 9. We've actually, as a board here, both last time and this time, had one of these highlighted. Some of the examples are the one we heard today on appropriate use of antipsychotics, but others are safe surgery checklist, a stroke action plan, and there were a number of others. And I think the committee was very impressed. We heard about how the projects were selected, how they had been rolled out throughout the organization, and the organization's real commitment to not only have them be excellent in pockets of the organization, but to have a plan for spreading the work throughout the organization to have the maximum impact on quality and safety within the entire province. So I think that we're the committee had a good discussion about the significance of this approach. It was noted that there is a significant investment up front that is required, but obviously a huge return in terms of, in particularly safety and quality, but also in terms of efficiency and simply better care. So there was a support on the part of the committee for ongoing work through the SCNs. The fourth item that was considered, we received 2 reports. One was from the Patient and Family Advisory Group, the 2014-15 annual report. And as was mentioned, Madam Chair, in your opening remarks, the commitment of patients and their families to support the work of AHS, to give us feedback, to participate in improving the quality of the care that we give is notable, and the annual report, I think, really highlighted for the committee the extensive nature of that involvement on the part of patients and families in these advisory groups. There was also a report from the Alberta Clinical Council, and that annual report really highlighted, I think, for the committee the importance of the work that these sort of representative caregivers and professionals throughout our organization provide to us in terms of their perspectives and their advice. So those reports were received by the committee. There are 2 items that the committee considered that require board approval. I'll deal with the first one and then put forward that motion and then go on to the second. There was an annual report regarding accreditation. AHS has significant accreditation activities. We have ongoing involvement with accreditation processes throughout the organization. We annually obtain and maintain accreditation status from the appropriate accreditation bodies, depending on the particular realm of activity. And then we do an annual report that summarizes our accreditation activities, including our progress on any recommendations that have been offered by accreditation bodies as part of that process, so that we can continually improve. And this report was reviewed by the committee and received and is recommended to the full board for your approval. And then this report will then be moved on and shared with the Minister of Health and then posted on the website. So as a result of this, I would move that the Alberta Health Services Board approve, 1, the Alberta Health Services accreditation status and activities for Health Facilities and Programs Annual Report, the report, and 2, the board chair deliver the report to the Minister of Health by March 31st, 2016. I so move.
Seconder? Marley, seconder. Any discussion of that? Questions? No. All in favor then? Carried. Thank you.
Thank you. And then the second item for board consideration is the structure of the quality assurance committees. We have a number of processes throughout the organization that contribute to the quality and safety within AHS. One of such mechanisms is the quality assurance committees, and they review certain system issues to improve quality. We've had an existing structure in place, as I understand it, since 2012. And with the experience now under our belt since that time, there are some proposals to change and streamline the committees to reflect the alignment of the structure, to reflect the maturity, in a sense, of the organization's development, and also in some cases just to reflect some housekeeping items about updating terms of reference and workload and that sort of thing. So there are a number of changes that, as I said, are housekeeping in nature, updating names, membership, and in 4 cases there are subcommittees that have been operational. I think the proposal at which the committee agreed with was that these 4 subcommittees now become fully operational committees and proposed to be established as permanent committees. So therefore, I will read the motion for the board's consideration. I move that the board approve the following as outlined and contained in the table received by the board. 1, that the proposed Quality Assurance Committee, or QAC, name and or membership changes to be more reflective of the current organizational structure and the organizational programs the QACs represent, zones, sites, programs, SCNs, as reviewed by the board. 2, the proposed changes to the establishment and purpose in the Quality Assurance Committee's terms of reference better define the scope of activities as reviewed by the board. 3, that the proposed changes to the other activities provision of the Quality Assurance Committee's terms of reference to make the provisions consistent with the work that is done by the QACs as reviewed by the board. And 4, that the proposed Alberta Health Services Quality Assurance Committee structure changes include the following 4 changes. Firstly, that the Cardiac Sciences Calgary Zone Quality Assurance Committee be established, which was formerly the Calgary Zone Cardiac Sciences QAC Subcommittee of the Foothills Medical Centre QAC. Secondly, that a Neonatal Calgary Zone QAC be established, formerly, again, a subcommittee of the Calgary Zone Complex Review QAC. Thirdly, that the Women's Health and Perinatal Calgary Zone QAC be established, and again, this was formerly a subcommittee of the Calgary Zone Complex Review QAC. And fourthly and finally, that the South Health Campus QAC be established, which was formerly a subcommittee of the Calgary Zone Complex Review QAC. And that table, once this has been finalized, will be posted on the public website. So I so move.
Right. Seconder? Brenda? All those in favor? Carried.
And the next meeting of the Quality Assurance Committee is scheduled for May 25th.
Great, thank you. Well, I think that comes to the end of our agenda. It's been riveting, I know. But really, it's we've accomplished a lot in the last month. And, on behalf of the board, I really want to thank the senior management team at AHS. What we've done here today really represents a lot of work over many months and the work of many, many people within AHS under the leadership of our senior team and Verna. So I really want to say thank you very much for that. And thank you to the board. And could I have a motion to adjourn? Q. All in favor? We're adjourned. Thank you very much.